Why isn't your oncologist telling you about other options other than surgery, radiation, and chemo? Good question. Until the 1970s, and you may or may not know this, until the 1970s, the only tools that we had essentially as a species to fight cancer were surgery and radiation. And then through the 50s and into the 60s, chemotherapy was experimented with, and it actually didn't become a formal discipline. Medical oncology did not become a formal field of practice until the early 70s. And it was established essentially for doctors to be able to administer and monitor chemotherapy to cancer patients. So those have been the three tools that our healthcare systems have had as cancer treatment has been evolving. So that's kind of one main answer, is the system is naturally set up to provide you with those three things: surgery, radiation, and chemo. And a lot of cancer agencies around the world still kind of insist on those being the three main things that are done first, and then maybe genetic testing will be done in third or fourth line, and maybe targeted or additional therapies will be offered down the road. So that's pretty standard treatment right now. Another way to answer that question about why my doctor really is only offering those three is that in most standard of care facilities right now that are treating cancer, genetic testing isn't really done. Or if it's done on a very small number of genes, like 5, 10, 20 at most. You can literally test every gene in your body, almost 21,000 of them right now, just for contrast to what's done in your hospital versus what's possible. So a lot of times doctors aren't offering you any options like immune therapies, targeted therapies, antibody drug conjugates, things like that, because they haven't done the diagnostic testing to identify which of those therapies you would need. What is interesting for you to know, though, as a cancer patient or patient advocate, is that if you take matters into your own hands and you get a good quality tumor DNA, a tumor RNA test, your doctor will use that information to inform your treatment. So you can help your doctor help you by getting some excellent diagnostics in the form of tumor DNA and tumor RNA sequencing, and then your doctor will have more options to offer you.